we all are here today because we all are concerned that climate change is a public health emergency that are impacting mental health and physical health and brain health of people. And it's especially affecting people with pre-existing mental illnesses or brain health disorders, young people, and other vulnerable groups that are more at risk of mental health and brain health impacts. We know there are a number of individuals, community, system level responses to the climate health challenges. And without further ado, I just wanted to hand over the time to our special guests today, Susan Deering and Samantha Green.
Okay, thank you very much for having us. We really appreciate this opportunity to speak to you about heat. And so I'm going to get us started and sort of set the stage a little bit about what we're looking at, and then hand it over to Samantha to talk about more of the health system impacts, and then what we're hoping to engage in dialogue with at this level for the TAHSN hospitals. So, Brittany, if we could have the first slide. So
Oh,
I'll
and Susan, do
probably,
you want to
oh,
introduce
yeah.
yourself first?
Oh, sure. Yeah, sorry, I know everybody was kind of sent the blurb. So I'm a family doctor at Sunnybrook. I work in the Veteran Center, so I work with some of the oldest old and some who are, of course, some of the most vulnerable folks. And working on heat resilience has been a focus of some of my academic work over the last few years. So this is very near and dear to my heart, as I know it is with Samantha as well. So I'm sure everybody remembers the heat dome from 2021, and I think we would all love to think that something like this will never happen here in Toronto, and that we are not at the same level of risk. But I think if we look at the numbers that are projected, we can reasonably assume that we are going to experience more heat, and an event like this is probably not outside the realm of possibility. So Brittany, if I could have the next slide. This was a report put out just a couple of years ago by the Toronto Regional Conservation Authority. And you see on the left there the number of projected very hot days, so days over 30 degrees from now until 2100. And on the right, you see the number of projected heat warnings. And we are right now in the second block of bars between 2015 and 2040. And even in this short time frame, we are anticipating a significant increase in the number of hot days and heat waves. If we look at just last year, 2025, there were 17 days over 30 degrees and 6 heat waves in last year alone. So, this is something that we are certainly facing right now. And we know that this has impacts on human health. So next slide, Brittany. We certainly know in the short term, and people hear about things like heat exhaustion and heat stroke, but there are so many other impacts besides those things. We know that mental health is made worse when it's very hot, and there's an increase in suicide attempts. We know that chronic diseases are made worse. There are negative impacts during pregnancy. We see an increase, for example, in preterm birth when it's hot. Older adults become socially isolated. And if we needed an example, if we needed to know what the impacts of social isolation are for older adults, we have only to look a few years earlier during the COVID-19 pandemic and all the negative impacts that social isolation had for our older adults. And of course, there's an overall increase in mortality just in general. And next slide, Brittany. It's not just older people, though, and not just people who have poor mental health. There are so many different groups that are at increased risk. So people who are more likely to be exposed, like people who work outdoors, people who are physiologically at higher risk. Maybe they're taking a medication that makes them less likely to sense heat, or that increases the risk of dehydration. or there are groups that are just not able to access information maybe in the same way or don't have the same resources. So people who are living in poverty or people who are unhoused. You'll see there in the top group, urban inhabitants. So pretty much everybody who lives in the city of Toronto is at increased risk. Well, you might say, okay, but there are things that we're doing, things that are interventions that are being made, like, for example, cooling centers. And so we'll talk about cooling centers for a minute, Brittany, next slide. So cooling centers, yes, they are an important intervention, and they are part of helping people to stay cool and to be protected. But they are not perfect and they don't suit everybody. There is some stigma being seen as vulnerable, and needing to go to a place like a cooling center is not something that many people are willing to do. They only operate during the daytime, and people actually need to go there. And so for people like, for example, older adults who are shut in, it just may not be an option for them. And then next slide, Brittany. We also know that cooling centers really don't fully address the problem. So there have been studies that have looked at what is the benefit, for example, for older adults. And when we do studies in a lab, for example, and take older adults to a cool place for a couple of hours, it only really has a short-term impact on their core body temperature. And so only decreases that cardiovascular strain that is caused by the excess heat for that short term. Cooling centers don't address the issue of sleeping hot, also because they only operate during the daytime, and sleeping hot is a significant risk factor when it comes to human health. And then you might say, okay, but like the city of Toronto, for example, has been giving away air conditioners, and they're trying to meet the need for people who don't have access to home cooling. And yes, that is true. And we'll have the next slide. But there is still a gap. And we know that the people who are at higher risk, people who are living in poverty, are almost 50% likely to not have access to cooling or air conditioning. People who live in rental situations are also almost half as likely to not have air conditioning. It's very much tied to income, very much tied to your socioeconomic situation. And so all of these things together mean that the increase in demand for healthcare services is going to go up related to heat. And so then we have to start to ask the question, is our healthcare system ready? And are we going to be able to meet the demand with the impacts on the healthcare system itself? And so I'll pass over the floor to Samantha to talk about that.
Thank you. And I'll just quickly introduce myself. I'm a family doctor at St. Mike's at the St. Mike's Family Health Team, and I also work in a women's shelter with Inner City Health Associates. And I've been working with the Collaborative Center on and with Susan on heat impacts for a little while as well. So, what are the impacts on the health system when there is a heat warning or a heat wave? Well, there's the risk of system overload, infrastructure failures, and care disruption. And we saw this during the BC Heat Dome event, where Vancouver Fire Rescue Services reported a threefold increase in call volume and waits of up to 11 hours for ambulances. At that time, there were also significant infrastructure failures. There were overheated hospitals, operating rooms that had to shut down, non-functional ambulances, and many long-term care facilities and mental health institutions that lacked air conditioning. There's a study, a modeling study published in 2023 that also looked at the potential impact of a multi-day power outage co-occurring with the heat wave, and they modeled the impacts in a few American cities. And one thing they found is that 50% of the population of Phoenix, Arizona would require emergency department level care for heat stroke if there was a co-occurring power outage and extreme heat. I mean, we are not Phoenix, Arizona, but it's a potential impact that we need to be thinking about at a health systems level. What would the demand be for health services if people didn't have access to air conditioning during a heat wave? The 2010 heat wave that hit Quebec led to approximately 3,400 more admissions to emergency departments than would have otherwise occurred. So it's not just that 2021 BC heat dome as a one-off special occurrence. We've seen heat waves before, and we've seen health system impacts from those heat waves. Next slide. So are we ready? Are our physical spaces ready for extreme heat? Are we ready for extreme heat and a power outage? Will we be able to provide care? Will our ORs function? Will our CT scanners function? What about our healthcare staff? Are our healthcare professionals going to be ready? Next slide. So what is the role for this table for TAHSN leadership? Well, I think we've come up with a few things that can be done. First is to prepare facilities, and this goes beyond either my or Susan's expertise, but really thinking about a possible power outage, a code gray, during extreme heat. What would we do in terms of like running the actual facilities? We also have to prepare our workforce. With our occupational health and safety team, think about impacts on workforce availability, think about education and tools for early recognition of patients at risk of heat-related illness, potentially think about discharge planning during extreme heat as well. Thinking about systematic clinical screening, so identifying heat vulnerable patients, reviewing medications, assessing indoor heat exposure, and delivering targeted education to the healthcare staff and then to our patients. Thinking about partnerships with municipalities, City of Toronto and Peel, thinking about how we can partner together for systematized heat response structures. Thinking about community partnerships, so working with community organizations that are already out there, working with marginalized and vulnerable communities, and working with EMS as well to support outreach to high-risk residents. Thinking about implementing routine indoor temperature monitoring in long-term care facilities and other congregate settings that, as hospitals, we are helping to run. And then finally, really being accountable to the communities that we serve, thinking about our social accountability and what that might look like. So, for example, providing public access to cool spaces when needed, opening up hospital atriums when it's the only cool space in town. Next slide. There will be time for discussion of all of those ideas, but I wanted to take a moment to introduce you to the heat response working group that has kind of emerged in a very informal way. Right now, it consists of physicians, faculty, and staff from across TAHSN and also U of T. And you see on your screen a list of members, and we sort of came together without any formal structure. But we've been collaborating to develop a strategy and activities to enhance heat preparedness across the city. As healthcare providers and people working in health institutions. And we are looking to formalize our structure and formalize membership in our structure over time. And we formed just in the fall of 2025, so we haven't been organized for very long. And so we're hoping, we're rolling out some programs and education this summer, and then we hope that over the next year we'll continue to formalize and work on other projects. And you can go to the next slide. So this is what we've done so far. It's pretty impressive, I think, for an informal, loosely formed group that just started meeting in last fall. We've laid this out in three kind of pillars of activity. So the first is we are building partnerships and looking to set the foundation for a future common alert or common protocol in response to extreme heat. We have also been developing education for clinicians and other people working in the health sector. We have a newly launched website housed at CAMH. We also have been planning, Brittany has mostly been planning an ECHO. So that's, a series of webinars, interactive webinars using the ECHO model focused on heat over this summer. And we are looking to also develop customizable educational offerings that could be targeted to specific clinical groups. And then we also have an emerging group of researchers who are looking to, look at the data, kind of figure out what is happening across TAHSN hospitals, and hopefully come up with some helpful answers. Who is most at risk here locally in Toronto? What are we seeing in our emergency departments and inpatient units? And what does that mean for policy planning? Next slide. And next week, we have a very exciting event, a whole morning devoted to talking about what we can do to protect our patients from extreme heat as healthcare providers. Toronto Public Health is also sending people to this event. We'll have people from community organizations as well, but the focus really is what we can do in healthcare. So we invite you to come and join us. Message Brittany if you are available to join. I think it's going to be really useful. We'll have people really talking to each other about how best to collaborate.